Hello, I'm Miss Ruiz, and I would like to thank you for joining me for OST 248 Diagnostic Coding. Today I'm going to cover Chapter 1, and my hope through doing these videos is to eliminate some of your anxiety. Diagnostic coding, as we get deeper into it, you'll start to feel a little bit more comfortable with the process and realize it's not as scary as you once thought it was. This is one of those things that sounds like it's impressive, but when you really know how to do it, it's just logical. So let's get started. All right, Chapter 1. After completing this chapter, you should be able to explain the four purposes of medical coding, identify the structure of the ICD-10-CM Diagnosis Coding Manual, differentiate between the types of procedures and the various procedure coding manuals, examine the HCPCS Level 2 Coding Manual used to report provision of equipment and supplies. All right, key terms that you'll want to know. I am going to have flashcards for these. So key terms: classification systems, condition, diagnosis, eponym, external cause, inpatient, medical necessity, non-essential modifiers, outpatient, procedure, reimbursement, services, and treatments. All right, the purpose of coding. So a diagnosis, that sounded really weird. A diagnosis code explains why the patient requires the attention of the healthcare provider. A procedure code explains what the physician or healthcare provider did for the patient. This is amazing. So, what I want you to do, whether you're in OST 248, which is diagnostic coding, once you get your documentation, your question to yourself should be, what brought them in? Why are they here? When you're in Miss Marjorie Parker's course, OST 247, I want you to ask yourself, what did we do? What did we perform? That's the main difference between the two. That's going to help you really narrow in on your documentation and help you pull that out. All right. Coded health data is used for medical necessity. So we need diagnosis codes to prove why we're doing a procedure, right? Statistical analyses, reimbursement, and resource allocation. So, for instance, say we put on a cast, and there's a lot of different steps and tools used for that. We need to know that if we're using that lining or the gauze or the cast material, that we're able to replenish that supply so that we're not short later on whenever we go to do it again. So by knowing how many casts we've done for this month, we know how much supplies we need to order to replenish that. All right, medical necessity, one of the most important reasons. So based on healthcare industry standards of care, explains the valid medical reasons why a procedure, service, or treatment was provided. Again, that's where your diagnosis codes come in. Your diagnosis is that supporting information for those procedures. If we don't have a diagnosis documented that requires a certain procedure, there's no medical necessity. It's not stated in the chart that this patient even needs this. All right, statistical analysis. Research organizations and government agencies evaluate and study data provided by the codes to develop programs, identify research areas, allocate funds, write public health policies that will best address areas of concern for the health of our nation's population. So, examples of this, say there's a certain state or even city where there is an increase in colon cancer, or say there's an increase in lung cancer, or it could even be as small as like the flu numbers and concentrations. So it really helps our government and like the CDC understand where they need to send resources. Say there's an epidemic somewhere. They are able to track it, and that supports the need for those extra supplies or extra funds that are needed. All right, next, reimbursement. So third-party payers use our coding data to determine how much they should pay healthcare professionals for the attention and services they provide to patients. This is the role that coding plays in the reimbursement process. Third-party payers, Those are your insurance companies. So like Blue Cross Blue Shield, Aetna, Cigna, so on and so forth. All right, resource allocation, kind of what we were talking about earlier. Administrators and managers must ensure that all resources, both human and equipment, are employed in the most efficient and effective manner. Codes can be analyzed by computers to identify the largest patient population diagnoses and most frequently provided treatments and services. So with these details, staff members, equipment, money can be directed to those patients and locations that need them most. So for instance, in a hospital, if you're seeing an uptick in certain conditions, then you know that you need more physicians there to help treat those patients, as well as resources that are needed to treat that condition. All right, next let's look at type of codes. So, diagnosis coding uses ICD-10-CM, that stands for International Classification of Diseases 10th Revision, Clinical Modification. Then we have procedure coding. So we have 3 different manuals we're going to mention. So we have CPT, which is Current Procedural Terminology, technically it's CPT-4, Current Procedural Terminology 4th. And then Healthcare Common Procedure Coding System Level 2. These are your HCPCS codes. That's what we call it in the field. We love to acronym everything. So with HCPCS, that is going to be a lot of your DME, durable medical equipment. Sometimes you'll have your immunizations here. This specific procedural was by CMS, and they want to make sure that you are using that if you have a Medicare or Medicaid patient. Although it is also used outside Medicare and Medicaid. Next, we have International Classifications of Diseases 10th Revision Procedure Coding System. That's ICD-10-PCS. Now, you don't have this manual, and that's okay because our intentions are not to go too deep into PCS. We're just going to kind of cover it lightly. If you do come across an assignment that is a PCS coded related question, meaning is expecting you to look up the code, please don't hesitate, send me an email so that I can fix that. Because that would be an error that I missed because I'm human. Anyway, moving on. Diagnosis coding, my favorite. So, used by all healthcare providers and facilities, we're reporting why the patient needed the care. So this, again, is our medical necessity. You will hear that throughout this entire course, and you've probably heard it throughout your educational career thus far. So consistent of a 3-character code category and at least 3 additional characters. Always, 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 always begins with a letter. Up to 7 alphanumeric characters. Always a dot between the 3rd and 4th character. So, as you can see in this example, we have code A12.3K5A. That last A is in the 7th character place, and we will cover that as we go. Procedure coding. CPT procedure codes, used by physicians to report services provided at any and all facilities. Also used by outpatient care, for example, ambulatory surgery centers, hospital emergency rooms, hospital outpatient surgery centers, etc. It reports what was done for the patient. It always consists of 5 numbers. There's no punctuation. So example here is 1, 2, 3, 4, 5. So a CPT code is always going to be 5 numbers. All right, ICD-10 PCS, which is procedure coding as well. It's only used by hospitals and is reporting facility services to inpatient. So that's why we're not really going to focus as heavily on it. Inpatient coding is a specialty. So if you go into the coding field, if you decide you want to become certified in inpatient coding, then that would be the time that you would want to increase your PCS knowledge. It always consists of 7 alphanumeric numbers, no punctuation. So as you can see here, our example is 012B4LZ. Now, unlike the other coding manuals, with this manual, you actually build your code. It's not already given to you. So depending on the different variables that are related to that procedure is going to determine what your code is going to look like. I mean, well, it will determine what your code will be. It will always be alphanumeric. All right, equipment and supplies. HCPCS Level 2 services and supply codes. Used to report services and supplies not already represented by the code in CPT. So such as transportation, drug administration by a healthcare professional, durable medical equipment, and so on, used by any facility or provider. It always consists of a letter followed by 4 numbers. So as you can see here, we have A, 1, 2, 3, 4. Other ones that you'll get used to seeing are J codes. That would be your drug administrations. All right, chapter summary. So essentially the process of coding begins with the physician's documentation stating why the patient needs care and what was done for the patient during the visit. As a professional coding specialist, you will interpret the documentation in the patient's record from medical terminology into codes. Diagnosis codes will explain why, along with how and where if the patient is injured, and procedure codes to report what the physician or facility did for the patient during the encounter. You will need to confirm that the diagnosis code or codes support the medical necessity for the procedures, services, and treatments provided. As you proceed throughout this textbook, read carefully and completely. I can't stress that enough. Coding is like nothing you've ever experienced before, and you want to learn how to be proficient. In coding, proficiency is key. Another thing I do want to stress from this slide specifically is your diagnosis codes explain why, how, and where if the patient is injured, which means when we start coding injuries, you're going to see that not only will we have the diagnosis, we're going to have to explain how they ended up getting injured. So if it's an injury and not just a condition or a disease, then we need to explain how they became injured. And don't worry if you don't remember all of this, we will cover that later. But I do want to lay that foundation so once we get to that area of actually coding it, you'll remember. Thank you for joining me for chapter 1. That is all I have for you. Thanks for joining me. I'll see you next time.